This was a massive revision of the death toll and probably doesn't ease a lot of doubts about its transparency or reliability of those numbers.
Yeah, it doesn't. And it also appears to be an official response to that strong international criticism that's been out there about the quality of China's COVID-19 data and its data transparency. Look, on Saturday, China reported close to 60,000 deaths caused by COVID-19 since early December. That was around the time when the country suddenly ended its punishing zero COVID policy. And previously, China had reported only 37 deaths caused by COVID-19 since December the 8th, which was a remarkably low figure given the evidence that was out there, the scenes of overwhelmed hospitals and overwhelmed crematoriums. Now, on Saturday, we also heard from a senior Chinese health official who said that they believe that there are indications, signals that the current outbreak may have peaked. I want you to listen to this.
Across the country, fever clinic diagnosis and treatment volume peaked on December 23, 2022 at 2.867 million. It's been since consistently declining, decreasing to 477,000 on January 12th, a drop of 83.3% from the peak.
Now, China has been accused by the World Health Organization for underrepresenting the true scope and scale of its current runaway outbreak in terms of hospital admissions, ICU admissions, and deaths. Concern has been raised by world leaders, including U.S. President Joe Biden, at not taking any chances. Quite a long list of governments and countries around the world have imposed restrictions on Chinese travelers. But in regards to this new revision, this revised death toll from China that was just reported, it is indeed exponentially higher compared to what they previously reported. But is it to be trusted? I posed that question to a number of public health experts earlier today. I want you to see this. This is a response I got from Yanzhong Huang, who's with the Council of Foreign Relations. And he tells us, quote, given the still huge gap between the official count of COVID deaths and the international estimate, I don't think the revision will quell outside doubts on the government data, unquote. And Jin Dongyan, a virologist at the University of Hong Kong, adds this, quote, I think that it should be the first step towards a more timely, open, and transparent sharing of COVID statistics with Chinese people and the world, unquote. Now, just last month, the University of Hong Kong study projected that there will be close to 1 million deaths caused by COVID-19 as China goes through this painful period of reopening. Back to you, Michael.
Yeah, I wanted to ask you real quick, too, the latest on the Lunar New Year travel rush. I mean, is it underway already?
It is indeed underway, and I want to share with you some video that recently came in to us here at CNN of just swarms of passengers at a train station in the southern Chinese city of Suzhou, ready to embark on their Lunar New Year holiday. The rush is indeed on. Earlier, we heard from Chinese state-run media reporting that Chinese officials are anticipating 2 billion journeys to take place during this Lunar New Year holiday, which is nearly double the traffic from the year previously. And this is why the World Health Organization and others have warned that this could be the ultimate super spreader event, that this could lead to another wave of infection. And there is particular concern, Michael, for the rural parts of the country. Of course, during this holiday, this is when many people travel from the cities. They go back home to their towns and villages and go into places that simply don't have the medical capacity to deal with an outbreak of COVID-19. Back to you.
Yeah, important aspect, no infrastructure. Kristie Stout in Hong Kong. Good to see you, my friend. Thank you.
Thank you.